Hey, it's Dr. Murphy. Today I want to talk with you about what you can do to reduce your chances of a stroke. So there are two main types of stroke, ischemic stroke and hemorrhagic stroke. Ischemic stroke is what we see most commonly, and that's when the arteries in your brain get blocked and the blood can't get through. You may think of it like pipes in the brain and they get clogged. That's what an ischemic stroke is. A hemorrhagic stroke, on the other hand, is when the arteries rupture open and bleed inside. So there's several different things you can do to reduce your risk. Some things you can't control, like your age. As you get older, your stroke risk increases. Your genetics, there's some things that make you at a higher risk. And we also see it more in women than we do in men, especially because women typically live longer. But aside from that, we want to focus on the things that you can control. So medical conditions like diabetes, high blood pressure, high cholesterol, obesity, those all we see increased risk of stroke. Some of the lifestyle things like smoking, drinking alcohol, and using illicit drugs like cocaine or methamphetamines can also increase your risk of stroke. If you have heart conditions like coronary artery disease or atrial fibrillation, the irregular heartbeat, you are at increased risk of stroke. So controlling those conditions can make a big difference. So if you have high blood pressure, making sure that you're taking your treatments, that you're watching your sodium, that you're exercising, doing everything you can do to keep that blood pressure under good control. If you have diabetes, making sure that you're watching your carbohydrate intake, you're watching your fiber, and making sure you're getting an adequate amount. Just keeping a monitor on your blood sugar and not just waiting until you go to your doctor's visit. And then if you have high cholesterol, again, your diet, your exercise can make a difference. And sometimes we have to use medicine to get those levels under control. So just make sure that you're focusing on keeping those medical problems under great control. The other thing we want to talk about is medications that increase your risk. This may be surprising to some of you. So over-the-counter medicines like ibuprofen and Aleve or naproxen can increase your risk of stroke. And it's more so if you use them long term, like for several weeks, months, or definitely for years. If you're just using them for a few days, a short course for like a cold or just to get some pain under control, then you may not be at an increased risk. It's more for those who use it long term. Birth control pills. If you use the combined birth control pills that contain estrogen, you may be at a slightly increased risk, especially if you're over the age of 35 and you smoke or you have a history of high blood pressure or history of some types of migraines also can increase that risk when you're on the birth control. There's some antipsychotic medications that also show an increased risk. So just make sure you're talking with your doctors about the pros and cons of medications when you're deciding if you want to take them or not. And aspirin, let's talk about that. So aspirin is a medicine that we use to help prevent stroke. So previously, if you were over the age of 45 or 55, we would recommend you take a baby aspirin. But now things have changed. We have more evidence that shows you may be at an increased risk of bleeding more so than you are at a benefit of reducing stroke. So if you're between the ages of 40 and 70, depending on which organization guidelines is being used, you may need to take a baby aspirin, but you would have to get that guidance from your doctor because it's not everyone. It really depends on your risk overall of cardiovascular disease. So they'll look at, your age, your health problems, your blood pressure, things like that. And they'll tell you if you're at high enough risk to where you need to take a baby aspirin. But please don't start a baby aspirin over the counter on your own. The guidelines have changed. It's not what it used to be. So keep those things in mind, and hopefully you can just do the best that you can to reduce your chances of stroke.